Hi everyone. I'm going to present the second week's discussion. So first we'll start off with the historical background and contemporary trends for adolescent health. So the historical background and trends would be their socioeconomic status, their environment in which they live in, how they are raised, if their parents are more aggressive or more passive, if they've experienced any trauma, and that is maybe physical abuse or mental abuse, and if they ever experimented, because in that age group they want to experiment, so it's kind of something they try and do, and I'll explain further. So that can be alcohol, smoking, drug use, and some factors related to adolescent health is actively doing risky behavior, like drugs, drinking, alcohol, having risky sexual behaviors. And that is, when I say that, I mean not using contraceptives. Also, their mental health can play a role if it is affected how they function. Like the book said, many mental health problems first emerge in adolescents and young adults. A permanent issue, and sorry if I mispronounce anything, my learning disability. Sorry, my learning disability is reading and comprehension, so just in case if I pronounce anything wrong, just let me know. A permanent issue to adolescent health is mental health. Many adolescents deal with mental health disorders like anxiety, mood disorders, impulse control, and substance abuse disorders. And I see that in my internship. My internship is at Montfort Therapeutic Residence. If you guys Google it, it helps youth and adolescent who have gone through the court system and might have a case. Well, they do have a case. It's a placement for them. And so it's a 7-month in-house and 5-month residential discharge, where we work with the families and the child to better relationships, advise them on different things to help them along the way. So they have drug group, life skills group, anger management. Just a little tidbit for you guys. Since I'm working with adolescents, this helps a lot. So for the next one, I'm going to switch it up and answer. They're not going to be in order. The common causes of morbidity and mortality is suicides, high-risk behaviors like tobacco use, alcohol use, poor diets, and low physical activity, illicit drugs, their risky sexual behaviors, like I said, and mental health can play a role. The biological implications for adolescents is genetic predispositions, and this means that they might be family-related risky behaviors, so they've learned from their family risky behaviors. Also, another one is direct hormonal influences, and this means that there might be something hormonally going on with the adolescent that they're having these risky behaviors. Timing of puberty maturation. And this is reaching puberty at an early age or a later age. So they deal with also genetics and hormones. It can be related to risky behaviors like drinking and smoking. And I also think this part attributes to peer pressure. Maybe someone looks like they are maturing faster, so they'll be more inclined to do the risky behavior. That could also happen later, where they think, they have to be part of the cool crowd, and they'll drink or smoke, because other people who have started maturing earlier are doing it. The later adolescents who are develop later might say, oh, since they're doing it, I might do it. And it's not always the case. Also, their brain and control of their nervous system. And this means their impulse control can be heightened and vulnerable. And that attributes to the risky behaviors, that they're vulnerable to risky behaviors because they're not mature enough. That's how I look at it at this part as well. Their frontal lobe, I learned this today at my internships, their frontal lobe isn't developed just yet. So the sensation of them always wanting to do something impulsive and on the go, as my fellow caseworker explained it to me, because she geeks out over the brain. She explains it as that center in their brain that gives them an impulse to go, 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 go. So do drugs, do drugs, do drugs, do drugs. Or that risky behavior factor. Their frontal lobe is not developed yet to tell them to stop. So at some point, 25 I believe is the age, your frontal lobe is 25 to 27, like something around that age, 20 to 25 or 20 to 26, 27. Your frontal lobe is fully developed, but at this age, it's still developing. So when I don't remember the name right now of the part in your brain that says, go, 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 please do this, do this, do this. It's your pleasure center. I believe it's your pleasure center. I could be wrong. But it's telling you to go. And adolescents, it's telling them to go, and they just do it without having their frontal lobe developed to tell them to stop. Oh, no, don't do this, because it's the wrong thing to do. Don't do this, don't do this. So that's where this comes in for me. Hopefully I'm understanding, hopefully that helps you understand that part. So their psychological common factors are cognitive behaviors, and this means that their perception of risky behaviors can be different in adolescents in their decision making. So they might not believe that they're doing a risky behavior. That's where I'm getting this from. They might be telling themselves that this isn't a risky behavior, where your brain development also comes in. So, yeah. Also, your personality roles play a psychological common factor. And to me, that, from my understanding, means that adolescent behavior can be unconventional behaviors like sensation seeking. And sensation seeking is taking a risk just for the sake of it, just for the experience. And that can be a personality role for an adolescent. Also, disposition characteristics. And this means that the adolescent's self-esteem, they might have depression, and control play a factor in them going out and doing risky behaviors. Some examples of an intervention, I would say, is maybe going to an outpatient facility. And some people at my internship, their parents put them on pins. Hopefully you know what that means. It's person in need. Not really sure what it means. They keep telling me and I haven't written it down. But it's a child that they just keep a watch on. And the school does it as well. I'm just gonna look at it while I read the rest of this. And sometimes they actually go to court and have the court system. Excuse me. My internship is actually with this. The court system mandates them to be placed in placement. So, Montfort Therapeutic, I believe Little Flower is one. Sometimes they place them in juvenile detentions. And at least for my placement, they try and work with the parents to help them better their relationships, because sometimes that's a factor for an adolescent's health to go on risky behaviors. Also, excuse me. Also, what is it? They try and teach maybe they don't know their their coping skills, so they teach them that, and they might have anger issues. So the court system sometimes gets involved, and that can be also with CPS cases. Sometimes that contribute to a lot of the clients that I have, especially the one I'm working with, has an order of protection. His mom has an order of protection. So there's that. And we're working towards actually helping him better his relationships with his parents, have better relationships later on in life, learning, and we're educating them about drugs, about alcohol, about contraceptives, mental health. Maybe they realize something. Maybe we're human. We might see something one way, but they might be able to, they know themselves. So if we can explain to them what depression is, and give them an example, maybe they can say, oh, I have some of those symptoms. Let me go talk to the caseworker and maybe we can work something out. Maybe it's something to think about. Or I have anxiety, stuff like that. I have symptoms of anxiety. How can I help myself? So that's for today, this week. Hopefully you guys like the video. And hopefully, I'm sorry for if I'm saying too many if I confuse you in any way. Also, if I just ramble on a little bit. This is very fascinating, so especially working with adolescents right now at the current time. That's why I a little geeked out about the brain thing. So hopefully you guys like it and have a great week.